Hi, good morning, everyone. Thank you so much for taking the time to join us today for our webinar with Dr. Huggett and Dr. Howes on the impact of screen time on kids and what our solution to that is. We all know that, having the kids glued to the computer screen or TV is bad, but on what degree of damage does it actually cause? According to a recent study by the National Institute of Health, children spending more than 2 hours on screens have lower thinking, reasoning power, and language processing ability. In fact, it causes the thinning of the brain area. It does sound scary, but I think there's no way of completely avoiding this, as we are in a new digital world where these devices are part of our connection with each other, be it for work, social, or school, especially after the pandemic. But we could mitigate the effect of it if we are well informed on what the risks are and how we could avoid the harm it would cause if certain steps and precautions are taken while we maneuver through this. So without further ado, Dr. Light would like to present to you two of our health professionals, Dr. Huggett and Dr. Howes, to talk about the risks and the solution on how we can maintain optimal mental and physical health for our next generation. Let me hand over the screen now to Dr. Howes.
Hello, I'm Dr. Jeanne Howes. I'm a local psychologist in Dunedin, Florida. I have over 35 years of experience working with families and children, and I'm just happy to be here to present with my colleague, Dr. Ed Huggett, who is a optometrist, a local optometrist in the area also. So I'd like to begin with sharing my screen. So if I can do that quickly with you guys. Let's see what I can do here. There we go. And here. Just bear with me here real quick. I've got to reduce this because it's covering my own screen here. Whoops, I apologize. Wait. Okay. I do apologize. I have a gray screen showing again as we had before, Dr. Huggett. So I'm trying to reduce that if I can. Okay, very good. All right, guys. So like I said, I'd like to begin with sharing my screen, and then we'll go on to, I'm going to start with screen time in the brain. As Julie said, more than 2 hours of screen time daily, we're showing evidence that it's lowering test scores in language and thinking. More than 7 hours a day, there is a thinning of the brain's cortex, which involves obviously critical thinking and reasoning. In addition to that, what we're finding is the neural connections are not being strengthened or maintained due to the lack of these offline experiences that kids are no longer having. We're very aware of the addictive properties of it. We're seeing that heavy use can cause brain changes that are linked to other addictive type behaviors. And video games are just pretty much like alcohol and drugs. It's a dopamine high, and that's why you see when you're trying to get the child to come off the game, they typically will get either verbally aggressive and sometimes even physically aggressive. It's no different than when you're trying to take the alcohol from the alcoholic. And then in addition, what we're finding is there is a higher increase in brain illnesses similar to or like depression, anxiety, schizophrenia, post-traumatic stress disorder, and Alzheimer's disease. I'm definitely seeing an increase of the anxiety and depression. I read an article recently that it's on the increase of about 400%. In addition, we're seeing those sleep issues. As we all know, sleep is very important, especially REM sleep. It involves storing information from day to day in memory. And when you're having a lack of sleep, it's going to affect those long-term memory. And you'll see this where a child might study all night and do really, really well when you're asking them the questions, but the next day When they actually take the test, then they tend to do very poorly or fail and don't understand as to why they're doing that. In addition, that sleep deprivation is linked to obesity, and we're seeing this in children anyway because they're spending way too much time in front of the computer or on the phone, and they're not getting those outside activities. And we know that obesity affects self-esteem. And with self-esteem, then they tend to self-isolate, and then it just becomes a vicious pattern. They'll play more games and self-isolate and so forth. Okay, let's talk about the negative effects of video games. There's aggressive thoughts and behaviors. The American Psychological Association, you know, there's a consistent, correlation between violent games and aggression. You also see this with TV programs, even cartoons. If there's any aggression in the cartoon, once the cartoon's turned off, the children will behave aggressively, even in play. With teens, what we're seeing is they start to present more riskier type behaviors, like drinking, reckless driving, drinking, smoking, and so forth, and even unprotected sex. I'm going to just change this real quick here. Excuse me, apologize. I thought I was, let me go up here. Okay. In addition, the effects of understanding right from wrong, it warps their sense of right or wrong. And that plays into the values, wrong values. On the games, you're seeing that aggression's being rewarded. They're learning that violent behavior and vengeance is okay. And of course, that's going to play into those wrong values. We already talked about the addiction of video games and the increase in depression and anxiety and social anxiety. You're seeing a lot more of social anxiety because they're not getting out there, they're not socializing enough in order to practice those social skills, which then creates some anxiety socially when they're out and about. Academic achievement, we know that this is definitely having an effect on academic performance. Obviously, the more the child's playing on the games, the less likelihood they're spending on academics, and those grades are going down. We're also seeing an increase in attention issues. There's more intense symptoms of ADHD and inattention. It seems like their concentration is good initially in short bursts, but damaging to that long-term concentration. And we are seeing an increase in diagnosis of ADHD. So it may well be due to video games. We talked about the health issues as far as obesity, but in addition, children are showing problems with posture and obviously bone density. They're not getting out there, they're not playing, they're not building that muscle and bone that's necessary later on in life. And they're learning bad behaviors from the children they're playing with or other adults, just bad characters that are out there. So let's talk about the positive effects of video games. It's not all negative. Some positives that we're seeing is that children are learning to problem solve more quickly. They're learning creative ways to problem solve. Definitely improving eye-hand coordination, fine motor skills. We're definitely seeing an improvement in that visual attention skills, which doesn't surprise us because that's what it requires. They're learning to multitask very quickly. It helps with their decision-making. It also assists in inductive reasoning or hypothesis testing. This would be similar to what they practice when they're working on a science project. They come up with the hypothesis, they test it, and with different strategies, and then pick the one that best fits the project. There's an increased self-confidence and self-esteem. You know, this goes without saying because they're happy, they're winning, they gain confidence when they're handling those challenges. It also provides those feelings of happiness and well-being. And then other positive effects would be memory, concentration, planning, visual recognition, and decision-making. Now, let's go into those screen time recommendations that are so very important here. The first thing we need to do, and I know it's difficult at times, but we need to create those screen-free activities and areas. And this is fairly simple to do. All meals, we don't need those electronics on or around that table. The bedroom should be free of all electronics, regardless of age, including teenagers. I also recommend that that TV comes out. And then for outside activities, church and so forth, they just don't need those electronics with them. So we're going to set up those screen-free activities and areas to reduce that screen time, especially with teens. In addition, we want to assist in choosing those media selections with our children. They need to be age appropriate. Often they're not. I see it in the office where, I'll have 5 or 6-year-olds that are watching inappropriate YouTube or inappropriate TikTok videos. You need to be aware of those. They're really bad for young children. Those videos, as you well know, link to other videos, and there's hours of watching endless clips. Parents also need to limit their own use. They need to put down their phones and show by example and show the child that they're more important than that phone. And they also need to emphasize priorities in life, that it's not the video games, it's not the electronics, it's personal relationships, health, sleep, exercise, and so forth. And they need to reduce that blue lighting emitting screen use and definitely avoid it before bedtime. We know this affects sleep and memory. Rather read with your child, especially using Dr. light lamps. As you well aware, if you're not, Dr. light lamps are used to protect the eyes from damaging UV and blue light rays. So a great product to use when reading with your child. Also, play online with the games with the child. Rather than forbidding them, let them teach you, and in return, teach them reading. So you can say to your child, listen, I'll play with you for 30 minutes, but for that 30 minutes, will you read with me? And generally, they're more apt to want to read when that little incentive's there. Definitely have to set those time limits. No more than 1 hour a day for 2 to 5-year-olds. For 6 and 12-year-olds, no more than 2 hours. And again, those teens, it's a little bit harder to implement a time constraints. So what I recommend there is come up with those media-free times that we spoke about earlier, and that's going to limit it itself. And then we need to focus on how kids are using the screens rather than the frequency of the use. Again, we're talking about older children, co-watch and interact while they are playing. So I want to close by leaving you with some thoughts here. And when you're deliberating on the pros and cons of screen time, I'd like you to recognize that boredom is good. In the old days, kids would say, I'm bored, I'm bored, I'm bored. Today, you're not hearing kids say they're bored. They're immersed in those electronics. So boredom's important. It creates creativity and imagination. So if we want our kids to be more creative and imaginative, we need for them to be bored. Also, kids need time to daydream, deal with anxieties, and process problems and thoughts. That's a learned behavior. It needs to occur. And then finally, I'd like you to ask yourself, when you see your child staring at a screen, what's happening in terms of their cognitive, emotional, and social development? So that being said, I'd like to hand over the presentation to Dr. Huggett, who's going to present the visual impacts with screen time on children.
Okay, very good. Thank you, Dr. Howes. And I want to just say that at the end of this presentation, we'll provide a time for question and answers, and I'd love to have some feedback also. And we'll be posting this video in various social media areas, and there'll be also opportunities for asking questions and interacting. So I want to introduce myself, Ed Huggett. I'm an optometrist for the past almost 31 years. As of May 12th, it's coming up. And prior to that, I was a public school teacher for 5 years. So I've got a pretty interesting experience and experience in terms of relating learning and vision and eye care. I've specialized in pediatric eye care for for all the years and learning how the eyes work and how a child's visual system and cognitive development work together. So I want to share my screen here and get into the presentation. So Julie, I'm not able, there we go. Okay, we got it now. So I want to talk about the impact of screen time on children, and in discussing that, there's so many different ways we could go with this conversation, but I'm going to hit the highlights of the subject, and hopefully in the future we can actually even provide some additional PowerPoint presentations and information on this. My presentation is not advancing. Just give me a minute here to see what I need to do. There we go. So everyone, including our children, are viewing computers much more than obviously a little over a year ago. So when we mention the term screen times, I want to define that. Screen time, we're discussing time in front of computer monitors, smartphones, smartwatches. And when you add up the total screen time for a child, in many cases, it may be 13 hours or more per day. So it really becomes a very significant part of a child's life. Processing about 2.4 megabytes of data per second. So each eye processes about 1.2 megabytes of data, combined 2.4 megabytes of data per second. The eyes are like two video cameras. So we really can think of the eyes like a video camera. But more than video cameras, they're actually living tissue, growing, changing, repairing themselves. And as a part of our central nervous system and subject to the toxic effects of the environment, and the environment meaning everything we eat, everything we look at, the light that impacts our eyes. And if you look at the environment, if the environment consists of a computer monitor, then we need to look at how the environment affects our children and how it's affecting their eyes and their central nervous system. Well, let's look at some of the major results of increased screen time. We're going to be looking at eye fatigue, a condition known as dry eye, focusing issues, increased nearsightedness, and changes in the wake-sleep cycle. And I want to really look at how we can bring solutions in to help decrease the effect of a negative effect of some of these things here. So let's look at eye fatigue first. Eye fatigue is produced because the eye actually has a number of different muscles. In fact, around each eye itself, there are 6 muscles to move it up and down, in and out, and even in a torsional movement. But there's 12 total muscles for each eye. But if you look inside the eye, there's actually also a circular muscle, and that circular muscle is called the ciliary muscle. It's actually a circular or sphincter muscle in each eye. And this is inside the eyeball itself. And it's a very active muscle. It contracts and relaxes thousands of times per day. So yes, eye fatigue is to be expected, especially when a child must focus on a flat screen for extended periods of time. And we'll be talking about what actually happens to that muscle when we're focused on it at a very specific distance for prolonged periods of time. So when you're looking at a screen, the focus muscle must maintain a specific level of contraction, leading to muscle fatigue. What needs to be done? Adjusting the distance the child focuses on and glare reduction. So throughout this discussion, I want to talk about glare reduction, flicker from artificial light sources, and blue light. We'll be talking about all of those. So how do we, and what do we do? So we adjust the lighting. There's something we call the 20-20 rule, and something I like to describe as the Harmon Distance. So adjusting the lighting to decrease glare, decrease flicker, and decrease blue light output. So glare, looking at the source of light, how it may be reflecting off of the screen itself. Also glare in terms of where the screen is actually placed. If you have a computer monitor or you're looking at your smartphone with a window in front of you, there'll be a great amount of glare being produced by that window. And of course, artificial light sources, especially fluorescent and some LEDs and SMDs, actually have a certain amount of flicker to them also. And then blue light, we're going to be talking much more about blue light here in a few minutes, but that's a big new subject on that's coming over the horizon that we want to discuss, and how it impacts a child's development in their eyes. So what is the 20/20 rule that we discussed? The 20/20 rule is that every 20 minutes, you take a break for 20 seconds and look at an object at least 20 feet away. And if you can't look at something 20 feet away, if you're in a very small room, you can always look out a window, or if you need to, if you can't even do that, then you can just close your eyes and just relax them for at least 20 seconds. Now, what is the Harmon distance that I mentioned? The Harmon distance, I like to think of it as a hand-arm distance. That's why it's easy to remember the term Harmon, but I think it was actually a Dr. Harmon that came up with that. But it's a distance between your elbow and the subject matter that you're looking at, and your eyes or your chin. You can measure it either from your chin or your eyes, like you see in this picture here. And that's going to be the optimal distance to look at computer screens, smartphones, reading material, and whatever else it may be. So the eyes are designed to function best when precisely put at this distance here. So you've got the best distance where your eyes are not overly focusing, but it's close enough that you don't have to strain at what you're looking at. So as a child grows older, their arms become longer. Obviously, that distance becomes longer. So this Harmon distance is actually accurate for any age person. Next area I want to look at is dry and irritated eyes. You know, the eyes are designed to function best when properly covered by a thin layer of moisture. So as we blink our eyes, our eyelids actually designed to spread this layer of moisture over our eyes, and that helps them to function best, maintain health, and focus. And this tear layer is maintained also by the tear glands and spread. In a normal number of times we blink, about 12 to 14 times per minute is our normal blink rate. But some of the studies have been very interesting, looking at the blink rate relative to mental concentration. And it's actually an inverse relationship. So as the concentration levels increase, our blink rate actually decreases. And it's not uncommon for a person to blink when they're concentrating very hard, looking at their smartphone or looking at a computer, to actually go down to 1 to 2 blinks per minute. What happens at that point is the evaporative effect of the eyes being open, the tears evaporating, and the actual small levels of salt, sodium chloride, in our natural tears, that concentration increases. And what that does is that causes irritation to your eyes. So hopefully this next picture won't gross too many people out here, but this is how we can actually test clinically for dry eye. We use this specific dye called lysamine green. It doesn't hurt when you put it in. It actually will stain parts of the eye that are irritated from dryness. And this is actually a very, very common appearance of dry eye. You can actually see where the actual turquoise or greenish areas are. That's actually tissue that's actually degenerating from the irritating effects of dry eye. And another little interesting fact, if you look down in the lower left-hand corner, I'm going to make clinicians out of all of you today. Look down that lower left-hand corner, you will see a little green band. That's actually on the eyelid margin. So it doesn't only affect, dry eye doesn't only affect the eyeball itself, it actually can affect the eyelids also. And another kind of interesting fact most people don't realize, if you look at on that lower left-hand corner, right along the eyelid margin, you'll see, got my pointer on it right there. There's a little duct. It's a little opening right there. And there's one on the upper lid. It's right up in this area here. Those are the two ducts that drain tears out of our eyes. So the eyelids, under the eyelids, the eyes are producing tears. It comes across the eyes and drains out. That's why when you cry, your nose starts running. It's because of the tears from your eyes drain into the back of your nose and causes your nose to drain like that. And that's how that happens. But if you don't have enough tears being produced, or too much draining out, or you're not hydrated, you can actually get very severe dry eye. And dry eye can cause increased infection rate, blurry vision, and other conditions. So what's the solution for this? Well, keep an eye lubricant nearby. lubricating drops. These are two of many over-the-counter. Sustain or Tears Naturel. Those are two good ones. But even more important than that, I think my first line of recommendations for dry eye is to hydrate. Hydration is a big problem. So many adults and children too, for that matter, are drinking highly caffeinated beverages, Diet Coke, Coca-Cola, Mountain Dew, Monster drinks, and so many other drinks have caffeine. And caffeine is actually a natural diuretic. So when you drink in a cup of say highly caffeinated beverage like a Monster drink or coffee, you're going to actually excrete more than a cup of fluid. You'll actually have a negative hydration level by drinking something caffeinated. So a good rule of thumb is when your mouth is dry, your eyes are already too dry. So that's good rule of thumb. So get the water in, get some increased hydration. So let's get back to focusing a little bit here, because there's one other point of focusing that I want to talk about, and that is not only the ability to focus on a screen, but also the flexibility of focusing. If we focus on a specific distance, there's actually a muscle that contracts. And if we look in the center of the screen here in the eyeball, you'll see a listing. It says ciliary muscle. There's actually a muscle right in the eye, right around in this range right here. It's that circular muscle we talked about earlier. And that muscle actually contracts to focus our eye for close up, and it will actually relax to allow our eyes to focus for something in a distance. And just like a muscle can spasm, if our focusing muscle is actually focused at a very specific distance for long periods of time, that muscle can actually spasm. Just like your leg muscles can spasm, your calves can spasm. Well, we call this an accommodative spasm, a spasm of the accommodative or focusing muscle inside our eye. And what that muscle does actually is it changes the shape of the lens inside our eye. So if you look on the left-hand diagram here, you'll see that inside, this is a cross-section of the eye, and that little oval design that you see there, that represents the actual natural lens in the eye. And the yellow lines and arrows are representing light coming from infinity, coming from a long distance away, focusing in on the eye. But if you have to look at something close up, that right-hand diagram, you'll actually see that the focusing muscle contracts, makes the lens get thicker, and that changes the actual focus of the eye itself. And that's actually is a very simplified way, but very accurate way to diagram how the eye changes focus from one point to the other. So what will happen is that if we're focused for long periods of time at the distance of the screen, you're actually getting, you can have a focusing muscle spasm. And again, solution to that is a 20-20-20 rule. Every 20 minutes, take a break for 20 seconds and looking at an object at least 20 feet away. Next area I want to look at, getting near the end, is what's called nearsightedness. And nearsightedness is where your eye actually focuses better at near. And a lot of people will say, well, I forget, I don't remember what's the difference between nearsightedness and farsightedness. Well, the best way to describe it and best way to remember it is the first part of the word, nearsighted for nearsightedness or farsightedness. That first part of the word is where a person sees best without their glasses or their contact lenses on or in. So nearsightedness may sound like just like an innocent focusing problem, but it may actually be triggered in children by them looking at close objects, and the eyes adjust to their environment. So if you think of it, if the eyes can adjust to their environment, if a child's looking at their screen monitor, their smartphone for long periods of time, the eyes will actually adjust to that environment and become more nearsighted. But the problem is, nearsightedness is not just some simple thing that you throw glasses on or contact lenses on. It actually has very serious ramifications for a child throughout their lifetime, because nearsightedness is a greater chance of cataract, greater chances of glaucoma, retina detachments, and retina degenerations. In fact, routinely in my practice, I see people with something called macular degeneration. And macular degeneration, common to the point where 1 in 4 people over the age of 70 have macular degeneration. And the setup for this macular degeneration occurs many, many years prior to that. And macular degeneration, if you're not familiar with it, it causes loss of color vision, loss of vision of seeing details, recognizing faces, being able to read, and so on. In fact, you can even be born with macular degeneration called juvenile macular degeneration. So nearsightedness is more likely when looking at objects for prolonged periods of time that are close up, especially true for children between the ages of 7 and 12. And the risk of nearsightedness doubles with more than 6 hours of screen time. And obviously looking at things close up. And who hasn't seen a child looking at their smartphone? And they may start out at, actually even may start out at the Harmon Distance, and within maybe 15, 20 minutes or so, where's that that smartphone? It's almost, it seems like sometimes almost right up the end of their nose. So you got to really remind them of the Harmon Distance. So that Harmon Distance, keep the distance of the object you're looking at far enough away. And surprisingly enough, all the studies are showing lately that the greater the time a child spends outdoors, the less chances they are of having nearsightedness. Makes sense. So their eyes are adapting to their environment. And if their environment is outdoors, looking at things far away, then it decreases the incidence of myopia, nearsightedness, and not only decreases the incidence, but if they have myopia, it doesn't progress as quick as it does for children that are more looking at things close up or indoors. Last area I really want to look at is sleep-wake cycle, or the wake-sleep cycle. Dr. Howes mentioned this also. Very, very critical because it severely impacts not only the eyes, but also impacts a person's cognitive ability and development of cognitive skills, thinking skills, and so on. The wake-sleep cycle is mediated by a part of the brain called the hypothalamus. It's just a little part in the center part of the brain. But the hypothalamus regulates melatonin release into the brain. And I'm sure many of you are familiar with melatonin. You can buy its over-the-counter natural supplement. And melatonin is promoted for increasing sleep. So melatonin released into the brain promotes sleep, and strong light and light in the blue end of the spectrum inhibits melatonin release. This leads to poor sleep, decreased performance in school and thinking and cognitive processing, and also increases with poor sleep. Cortisol level goes up, oxidative stress goes up. So there's a whole cascade effect of not getting enough sleep, looking at the monitor too long, using lights that have blue light output. And there's a solution for that. What can be done? So the first thing I recommend to my patients is use low blue light sources. And in doing that, you can actually increase the quality of a person's sleep. So what do I mean by low blue light? Well, we know that light has can be broken down into the spectrum from the red end all the way over to the blue end or violet end, just like a rainbow. That's how light can be broken up. And lights will have different amounts of blue light output. So if we look at the light on the left side, we're looking at what we call a warm light. It has a lot of the red end of the spectrum in it. And that'd be similar to like an incandescent lamp. Natural white lights have a little bit more blue light in them. That's the example in the center here. And if you look over to the right, even more blue light. That makes a light, we call it cool light, but it actually has quite a bit more blue light in it. And what's so important about blue or red or warm light versus cool light? Well, the more blue light in a light source, the more energy is actually being produced, more energetic light is being produced, and that light actually gets into the eye. And that higher energy blue light, those photons, that blue light getting into the eye, that energy goes somewhere. It's actually dissipated at the level of the retina and dissipated as energy. And it's that energy dissipation over time, that the cumulative effect can cause vision issues, retina problems, cataracts, and so on. So what is the solution? What can be done? Number one, decrease the blue light output by getting a proper light. Dr. Light lamps are designed specifically and have patented LEDs, we call them SMDs, that actually produce much lower blue light output, but maintain that nice white light output that we like to see. Also, lamps, most lamps on the market, they produce various amounts of blue light, but this is going to be your best option here. You can also, on smartphones, you can decrease the blue light output. They have what they call a sleep mode or evening mode, where it actually decreases the blue light output, and you'll notice it on your smartphones if you look at that adjustment, that the actual light looks more of an orangish or yellow. And in fact, I set my phone to have that setting all day long. So there's no reason that I need to have extra blue light impinging on my eyes. So in summary, what can we do? Well, we adjust the lighting. You had a light source like Dr. Light that has low blue light output, low glare because of its circular design, and no flicker to it. And remember the 20-20 rule, 20 minutes. For every 20 minutes, look at something 20 feet away for 20 seconds. Maintain your hydration, make sure your mouth isn't dry. If it is, get some extra water in, and if necessary, some eye lubricant drops can be instilled into the eye. And adjust the lighting so that there's low blue light. If it's on a source, it can be adjusted like your smartphone. And of course, I can't leave without saying an annual eye exam is critically important too. So a good eye exam, many times a child can pass the screening at their pediatrician's office. Pediatrician says, no, there's no problems here. But that screening is just a very, very cursory screening, typically looking at a chart far away. And that'll pick up the children that are nearsighted, the children that can't see far away, but it's not going to pick up children that are having visual issues that are close up. So that needs to be done too.